Tomorrow night marks 6 weeks since New Yorkers were told to put their lives on pause, stay home, and stop the spread. And today, Governor Cuomo says those efforts, those disruptions in your lives, they're paying off very clearly. He says New York State has seen 100,000 fewer serious infections than scientific models predicted. A lot of lives saved. But the governor warns the state has to ramp up testing before the economy reopens. And that is why he is signing an executive order. It allows independent pharmacies to do their own diagnostic testing. He says that means 5,000 additional testing locations. And our team is standing by to walk you through every bit of this right now. We start with News 4's Adam Harding. He's live in the Bronx with the state's new testing plan. A lot to uncover here, Adam. What do you know?
Yeah, and Adam, the big story today is all about testing. We know in the last 24 hours, the state saw 47,000 new tests, by far the biggest number. But it's pharmacies like the one behind us here that could soon see the state increase rapid testing in a matter of days.
Mayor de Blasio early Saturday touring a new community testing site.
Today is Saturday, and it is a beautiful Saturday here in Albany.
Just before the governor announced new plans to rapidly increase COVID-19 testing.
We're going to authorize all the independent pharmacists in the state to be collection sites for testing.
He's now turning to the 5,000 pharmacies across the state to help with diagnostic testing.
The Bronx needs this. In fact, all of New York needs it.
That includes Mount Carmel Pharmacy in the Bronx.
I would say that this is a great start for community pharmacy to be able to help.
Roger Paganelli is the owner of the pharmacy. He's been forced to adapt because of the coronavirus, including curbside pickup, but he's never once been forced to close down.
It's been difficult because a lot of our team is frightened of getting the virus. We lost about 2/3 of the staff, and some of those were just afraid to be in the business at all.
The governor is also expanding testing for the state's essential workers, everyone from firefighters and police to grocery store employees to MTA workers.
We're going to start off, the first day with probably a couple of hundred, but then we're going to ramp up very quickly so that we can get the entire workforce. It will take a little bit of time.
The MTA says quarantines for its workers are down almost 50% from its peak of 3,200, with more employees now returning to the job.
And in terms of antibody testing, tonight we are learning that 4 New York City hospitals will beginning the antibody testing for frontline healthcare workers. That list includes Bellevue, Elmhurst, Montefiore, and SUNY Downstate Health Sciences. And we also know that SUNY Downstate is only a COVID hospital, meaning the patients are all COVID patients. We're live tonight in the Bronx. I'm Adam Harding, News 4 New York.
Okay, Adam, step in the right direction. We know widespread testing so important for everyone right now. And the gorgeous weather out there lured a lot of people out of their homes into city parks today. Our cameras captured crowded walking paths, as you can see. Sidewalks around Central Park West very busy. Not everybody, as you can tell, even able to follow strict distancing rules. And across the Hudson in Jersey City, 5 city parks are set to reopen on Monday. Is that too soon, though? News 4's Miles Miller in Jersey City with the battle that the state still faces here, Miles.
Well, Adam, the answer to your question will be seen on Monday when we see those police officers and those parks and recreation folks out here enforcing social distance. All day we've seen people in this cordoned off area where there is caution tape up telling people not to play in this park. But on Monday, they'll be able to do just that. New Jersey Governor Phil Murphy put the state's staggering number of COVID-19 deaths in context today. More New Jerseyans have died from the virus than in World War I, the Korean War, and the Vietnam War combined.
When we say we're in a war, we mean it. This is literally a war. It's multiple wars in terms of casualties.
Still, the Garden State keeps showing signs of improvement. The outbreak leveling off, the number of new cases flattening, hospitalizations and ventilator use dropping. Governor Murphy stressing stay-at-home orders must remain, and businesses won't reopen anytime soon.
This is up to us and us alone.
But in some cities, signs of normalcy are beginning to emerge.
We are going to start gradually reopening all of our parks in Jersey City. The first step will be Monday when we're opening 5 of the largest parks in the city.
Jersey City Mayor Steve Fulop says police and parks officials will be on site to enforce social distancing, a plan that doesn't sit well with Damian Malachi, worried about keeping his 3-year-old safe.
The park, it may draw a large crowd, so it may not be good. As of yet, I don't think we're ready right now.
But Edris Dudley says,
I find opening the park on Monday a good idea. But the bottom line is I have to be responsible.
So this is an outdoor exercise gym here at this park. That will remain off limits. Also will remain off limits dog runs, playgrounds, anything that people can touch will be off limits. If people do touch the surroundings, we're talking about some of the gates here, the water fountain, all of those will be deep cleaned every day. The mayor's saying he wants everybody to remain safe during this pandemic. We're live in Jersey City tonight. I'm Miles Miller, News 4 New York.
Okay, Miles, thank you. Just a somber scene in North Jersey today. Newark police gathering there to remember one of their own. Daniel Francis died from complications with COVID-19 earlier this month. He served in the Criminal Intelligence Unit of the Newark Police Department, and Francis leaves behind his wife, 2 adult children, 1 college student, and a 6-year-old. He was 51 years old. Well, you can see the economic toll from this pandemic in this line you're looking at right here. So many people waiting in Washington Heights looking for help after losing their paychecks. Food pantries are facing a new challenge right now. News 4's Ken Buffa has more on the high demand and also the shortage of volunteers at things like this.
Swarms of hungry New Yorkers lining the block here in Washington Heights as food pantries across the city struggle to feed them.
We have 1.2 million New Yorkers out of work. And what does that translate to? That translates to no food on the table.
People are fearful, they're hungry, they're concerned about what's going to happen tomorrow. They're concerned about their children and their families.
Organizers say since the coronavirus outbreak, pantries are overwhelmed, forcing some to close down while others scramble to meet the high demand.
Prior to the pandemic, our food pantry was open 2 days a week. We were open on Wednesdays and Saturdays. We've had to increase that now to the 4 days per week. And of course, where we would see 300 people a week, now we're seeing 800 to 900 people a week.
So this pantry has definitely been definitely godsend.
But high demand means food is running out quickly, amongst other problems. Now, organizers say they're not only dealing with food shortages, but they're also dealing with a shortage of volunteers.
Well, many of the volunteers at the food pantries were in their 60s and 70s, and so a lot of these people decided to stay home because they feel they're high risk.
As COVID-19 cases decrease and progress is being made, organizers say they will continue to provide relief as best they can because so many rely on this lifeline that is fighting to continue.
I do have a resource that can be able to help me if I need some help.
If not for something like this, we would not have food in our homes.
Thank you. In Washington Heights, Ken Buffa, News 4 New York.
Now, New York City Poison Control says the number of calls for exposure to cleaning products doubled in the hours after President Trump's comments about injecting disinfectant. The president asked his task force on Thursday if there was a way that something could be done like, quote, injecting disinfectant to kill the virus. Within 18 hours, the city reported 30 cases of exposure, including Lysol, bleach, and other household cleaners. And during that same time frame last year, for perspective, there were only 13 cases reported. None of those specifically included Lysol. And we want to note that none of the cases reported led to hospitalization or death. So that's some good news right there. Here's some not so good news. More than 412,000 people in the tri-state have been diagnosed with COVID-19. Nearly 22,000 total have died from coronavirus across our area. That is almost half of all Americans who have now died from COVID-19.